In a pandemic, they are the heroes, healthcare workers risking their lives to protect ours. But the COVID-19 response has had a crippling effect on area hospitals.
As we begin our rebound, News 5 investigator Jonathan Walsh shows us how decisions made in the past may shape the future of healthcare.
Hospitals in crisis mode, all trying to stop COVID-19. But other things stopped too, like elective procedures and routine doctor's visits. The unintended consequence, healthcare workers furloughed, ERs closing their doors. So, how did we get here?
We're still seeing a large number of deaths. People are dying every single day.
No, let's go back, way back, 20 years ago, and how that affects us today. Back in 2000, there were 42 hospitals in Northeast Ohio. That's according to the Cleveland Hospital Association. Those hospitals had 30 different owners. But over the years, the hospital landscape shifted. An ownership arms race between Cleveland Clinic and University Hospitals.
We were teaching hospital.
Dr. Robert Haney worked at Mount Sinai Hospital for 22 years. The hospital was sold and then closed in 2000.
I came to the hospital and there was all the news channels and we were told we got 2 weeks.
By 2020, 5 other hospitals had closed, like St. Luke's and Huron Hospital. Other community hospitals bearing names of suburbs, Parma, Lakewood, and Euclid, taken over and repurposed. Despite all of that, Dr. Haney says he doesn't think patients are worse off today.
I don't think we've had a drop off in quality. In fact, I don't think you can get better health care anywhere in the world than in Cleveland.
However, longtime Lyndhurst resident Franco Foti says he doesn't see the benefits.
I just don't want to pay for things that are ridiculous charges.
Franco says consolidation is forcing him to pay more since doctors' offices are being absorbed into health systems or hospitals, and now they're collecting facility fees.
Now the whole thing is considered a hospital, but his office has not changed. I'm still going where I was going before, except that instead of being charged at $200-$400, now I'm getting charged $1,500, $2,000 plus.
This is something I've been looking at for a long time.
Dr. Martin Gaynor from Carnegie Mellon University has studied hospital consolidations for 40 years.
Prices are high and rising. There are egregious pricing practices.
Even testified in front of Congress.
This massive consolidation in healthcare has not delivered for Americans. It has not given us better care or enhanced efficiency.
He tells us in the past 20 years, there have been 1,600 plus hospital consolidations around the country. He disagrees with Dr. Haney about the caliber of care.
When there are mergers that between close competitors, the quality actually deteriorates.
He points to a study of heart attack patients on Medicare.
People who had heart attacks and were treated at hospitals that faced a lot less potential competition did a lot worse in terms of their mortality.
Dr. Haney does tell us there are still unacceptable infant mortality and longevity rates right here in Cleveland.
In fact, in Fairfax, where I do a lot of community outreach, it's much more like a second or third world country.
Today, Cleveland Clinic, UH, and Summa own 66% of the hospitals that were listed in 2000. Dr. Gaynor reports consolidations in general bring lack of competition, lack of options for patients, lack of appointment times available.
People really are worried about our healthcare system, and they're unhappy about it.
Tests confirm Ohio's first 3 cases of coronavirus.
Now, the worst case scenario, coronavirus. Big losses for hospitals when various procedures and treatments were canceled. The burden then shifts to the big 3 owners in Cleveland instead of spreading it out among many ownership groups.
Some nurses are being pushed to extremes. Others are being sent home, furloughed by hospitals all across Ohio.
More than $1.3 billion in losses per month, according to the Ohio Hospital Association. Losses that may only heighten the need for what some already deem as overly aggressive collection practices by nonprofit hospitals like the Clinic and UH.
There are reports of nonprofit hospitals going after people who couldn't afford to pay.
I got a bill from them, $26,000.
26 grand? Like 73-year-old Claudia Simpkins from Cleveland, who was sued after she couldn't pay for her one-night stay at the Clinic back in 2019.
And how do you feel about them coming after you for this money?
I don't feel it's right.
A quick search of the Cuyahoga County courts, lots of Cleveland Clinic lawsuits against patients just like Claudia. So we went directly to the CEO.
As the leader, what would you say to the patients who are looking at these and facing these lawsuits from your clinic?
to communicate with us, to approach the clinic. Oftentimes these things can be resolved through communication.
Cleveland Clinic's response to Dr. Gaynor's concerns and about why it's continuing to grow reads in part, "We know that high-volume medical centers can produce better outcomes for many procedures and more effectively and efficiently provide care." In a world now upended and hospitals just now starting to reopen more services, Dr. Gaynor says maybe COVID-19 can be a wake-up call.
We'll come out the other side determined to figure out what's the best thing to do about our healthcare system so it really works for all of us.
Lots of questions remain because of coronavirus. Will the health divide widen? How do hospitals rebound? And will the financial losses from health systems be placed back onto the patients? You have our word. We'll follow all of this for you. I'm 5 on Your Side investigator Jonathan Walsh.
Now, UH did provide us with a statement as well, reading in part, the COVID pandemic has highlighted an important benefit that results from having a comprehensive and coordinated network of hospitals working together. You can read the entire statements from UH and Cleveland Clinic on our News 5 app.